Hi everybody, it's Christina and Cindy, and this is the 6th episode of Rolling with Ruby. And today we're going to be talking about the top 5 things every caregiver needs to know before they bring their loved one home from the hospital. So number 1 is understand the condition and care plan before you bring your loved one home from the hospital. Cindy, tell me a little bit about what that means to you.
Well, you want to know, what is their diagnosis, is there anything that you need to look for when they're at home in case, something starts to go south?
Right.
What are the symptoms, signs and symptoms you need to watch for?
Yeah, kind of what's the recovery timeline?
Yeah, recovery timeline. As a therapist, I want you to know, what my plan is for your loved one and what I want you to continue to do with them at home.
Yeah, also an experience I've had before bringing a loved one home from the hospital is medication.
Yeah, it's huge.
Yeah.
It is huge. Because a lot of times, too, if you think about it now, the primary care doctor is not in the hospital anymore. You have hospitalists. And so if medications get changed, and they frequently do.
Yes, they do.
Then you really need to know that medication list and what has changed and, signs or any oh my goodness.
Yeah, side effects.
Yes, side effects.
Yeah.
I'm losing it today.
No.
Yes, any side effects, things like that.
Yeah. And did your loved one, were they having therapy, any kind of rehabilitation in the hospital?
Right.
What is that going to look like, especially as a caregiver, because that skilled care that they're receiving, your loved one's receiving from the hospital, from the nurse, from the doctor, from therapy, that's going to fall on your shoulders when you bring your loved one home if they're receiving any kind of therapy and stuff like that.
Right. And then one additional thing is if they have some type of a wound, you always want to know what the wound care is going to be, or the dressing or whatever.
Yeah. As far as speech therapy is concerned, we work with people swallowing and making sure that they are able to get their swallow mechanism works and they're able to get good nutrition. So what's their dietary needs leaving the hospital? Do they have any kind of restrictions? Is there a fluid restriction? Are they on a special altered diet that you need to know about? And how do you make that happen at home? And the big thing about that is before you bring them home, don't be afraid to ask.
That's right. Ask questions.
Yeah. Ask questions. That's what discharge planning is all about.
That's right. That's right.
And, when I worked in long-term care, we always said that discharge planning starts the day you're admitted to the facility. So I would assume you could probably start talking about that the same thing, when you're in the hospital too. So
right. And the other thing I suggest too, whether it's a doctor's appointment, whether it's a discharge plan, as you start thinking about things, write your questions down.
Yeah.
Because inevitably, once you get there, you forget what you're wanting to ask.
Yeah, because you got a million questions, and then when you get there, you can't
think of
one of them.
That's right.
All right, number 2 is prepare the home environment. That's kind of what we do, right?
That's right.
That's what we do with Adaptive Equipment and Caregiving Corner. So tell us a little bit about that, Cindy.
Well, we always talk to people about, home safety and what you need to do to prepare the home. Of course, we have on our site, aecorner.com, the top 3 areas that we always look at: toilet height, bed height, comfy chair height.
Yeah.
But you also want to look at pathways. Are your pathways clear? Yeah. What are they coming home with? Are they going to be in a wheelchair? Are they going to be on a walker? Yeah. And you need to make sure there's wide enough pathways, from like the bed to the bathroom, from their comfy chair to the bathroom or to the kitchen.
Right.
Pick up the clutter.
Yeah.
Make sure that there's not tripping hazards. Because that those, especially the first few days to the first 30 days home, you really want to. There's a high risk for rehospitalization, and we want to be prepared and ready to have them at home and keep them at home. Yeah.
Another thing that probably needs to be talked about is stocking up on supplies.
Yeah.
Not only medical supplies, but just supplies around, household supplies, toilet paper. If you have a pet, pet food.
Right.
Talk about maybe how is the person going to get their mail
Yeah, especially if they're going to be on their own or have limited help, maybe a couple of times a week or something like that.
Yeah.
The toilet paper, I know I had a client before that went home on her own after a total knee replacement, and she said if there was one thing that she made sure she had was a couple weeks supply of toilet paper.
Yeah.
Because that first couple of weeks you really don't get out much.
Right, absolutely. All right, number 3 of the top 5 things every caregiver needs to know before they bring their loved one home from the hospital is know the signs of complication. That is huge.
Yes, yes. And again, that is, asking questions. It's talking about kind of like the number one, that we talked about is knowing the diagnosis, what are signs and symptoms to look for, and just being prepared, side effects of new medicines, things like that.
Yeah, and that, again, talk to the doctor, ask the nurse. That, again, is what discharge planning is all about. So,
yep.
Okay, number 4 is seek support and resources.
Yes,
yes. That's important for caregivers as well. I think at any point in time during your caregiving journey, that's important to, to seek resources and stuff like that. You're not in this alone, so if your loved one has been diagnosed with something before, and before they leave the hospital, see if you can find a support group to talk to, that maybe they're going through kind of the same thing. Check with your area agency on aging. If you don't know who your area agency on aging is, you can go to our resource page at aecorner.com/resources, and we have the directory for area agencies on aging, so you can find your local one. But they are a wealth of information. They could, maybe set you up. See if your loved one qualifies for some of these programs. Set you up with something like Meals on Wheels. Right. You get out of the hospital. There's going to be all kinds of insurance forms and stuff. They have people that will help seniors in particular with their insurance forms, Medicare, Medicaid, and at least give you some advice on which way to turn, because some of that stuff can be so overwhelming, for some people. So make sure that you check with with the physical therapist, with the occupational therapist, speech therapist that might be coming into your home after home health, with the nurse, the home health nurse that's coming into your home, maybe afterwards. And the thing is that we always talk to people about, especially if they're getting therapy, and also nursing. They're getting nursing and skilled care. If there's something that they could qualify for nursing and or any of the therapies when they go home, that is an additional resource to help with that transition in those areas. Now, don't be mistaken, those are not 24/7, services. Those are going to be 2 or 3 times a week. But still, those are needed services to help with that transition home. That transition home is what's going to be crucial in those first few weeks, right after the hospital. Nobody wants to be readmitted, to the hospital. The patient, the caregiver doesn't want their loved one readmitted. The hospital doesn't want it readmitted. Want the patient to be readmitted. So, let's figure out some ways, some resources that you guys could reach out to help make that transition back home successful. And then also, because all of that skilled care and all of that information, all of that activity is going to fall on your shoulders as a caregiver. So make sure that you reach out to those resources that might be able to help you make that transition more successful. Absolutely. So number 5 is, I think, one of the most important things, and again, is kind of goes without saying, but we're going to talk about it because some people need to hear it, is take care of yourself as a caregiver. So caregivers, you're not in this alone. There are so many resources out there. If you start with your area agency on aging, go to our resource page on our website, aecorner.com/resources, and see that we've got the area agency on aging directory listed. We've got a listing for assistive technology programs in each state. We've got a resource, a directory listing for local lending closets. And again, back to the area agency on aging, they will be able to at least point you in the right direction and tell you what kind of services maybe your loved one qualifies for, or what kind of resources that you have available in your community, like home health, a home health aide that might be able to come in for a few hours a week to help you out. Respite care, find out about respite care. That's going to be really big in helping make sure that your caregiving journey is that you're taking care of yourself. Because why sin? You have to take care. Got to take care to care. Yeah, exactly. So and that's the other thing too that I just thought of is
a lot of people, not a lot of people, but some people may have a long-term care policy. You may want to look into that to see if there's some extra services that would cover, depending on, you know, the functional level of your loved one when they get home. The other thing is if your loved one, again, is getting therapy and they need to be transferred, you know, and when I say transferred, I'm talking moved from one service to another. You need to make sure that you are there in therapy, asking the therapist, letting them train you on how to do that safely for yourself as a caregiver. Because, you know, that can be very hard on you. If you're not doing it correctly, and they can give you the tips and tricks of doing it the most efficient way as well.
Save your back. I think caregiving's hard on the body, so anything you can do to save your body, save your energy, it's only going to help prolong and make your caregiving journey safer and healthier for you, and ultimately for the loved one you're caring for as well. So, all right, so that was it. The top 5 things every caregiver needs to know before they bring their loved one home from the hospital. So it's pretty important subject, wasn't it?
Absolutely, absolutely.
So thanks for joining us on episode 6 of Rolling with Ruby. Everybody take care, and take care of each other.